When is Heineke-Mikulicz pyloroplasty used for ulcer treatment? Imagine a situation where a person with peptic ulcer disease starts experiencing severe vomiting, feels full quickly, and begins losing weight. These symptoms often point to a blockage at the stomach's exit, known as gastric outlet obstruction. When ulcers cause scarring or inflammation that narrows the pylorus, the passage from the stomach to the small intestine becomes obstructed. This is where Heineke-Mikulicz pyloroplasty comes into play. It is a surgical procedure designed to widen that narrowed outlet. The surgery involves making a cut along the pylorus, both lengthwise and across, then sewing it back together to enlarge the opening. This helps food pass more easily and relieves the symptoms caused by the obstruction. This procedure is mainly used when the narrowing is due to benign causes like peptic ulcers that have healed with scarring. It is particularly helpful when medical treatments such as acid suppression or antibiotics haven't resolved the blockage. For example, if ulcers have caused significant scarring leading to pyloric stenosis, and medications no longer improve the situation, surgery becomes necessary. Sometimes, the procedure is combined with other operations, like cutting the vagus nerve to reduce acid production, especially in recurrent or complicated ulcers. It can also be performed during surgery for bleeding or perforated ulcers, especially if access to the duodenum is needed. Heineke-Mikulicz pyloroplasty is favored because it preserves the pyloric tissue while effectively widening the passage. It is most suitable when the ulcer tissue around the pylorus is minimal, allowing the surgeon to avoid removing large amounts of tissue. This surgery helps restore normal gastric emptying, reducing symptoms like vomiting and early satiety, and prevents further complications such as recurrent ulcers or perforation. In summary, this technique is used mainly when peptic ulcers cause pyloric narrowing that does not respond to medical therapy. It is an effective way to relieving obstruction, improve digestion, and prevent further ulcer-related problems. Always remember, any surgical decision should be made in consultation with a healthcare professional who can evaluate individual circumstances and determine the best course of action based on the patient's specific condition.